Hello, I am Dr. Romy Biswas, Professor and HOD, MJN MCH from Cooch Behar. Today I am discussing about the undergraduate exam ready series with IAPSM team West Bengal Chapter and our college of MJN MCH. So I will be dealing with some of the questions in the last semester in paper 1 and paper 2. So let's directly go to paper 1. In community medicine paper 1, there are certain groups you know already, group A, B, C, D. In group A, there are long essay type questions of 15 marks each. So here there was a question that how you will plan a study design to find out the association between alcohol consumption and dyslipidemia in a block of Cooch Behar district. What could be the limitations and bias associated with the study, and what is nested case control study? So these are some conceptual questions. So each one should write what you find out, what are the answers that may differ from one student to other student. So you should very carefully read the question and try to answer it step by step. So you should not jump directly to the study itself. So what should be the proposed study design? It can be any study, like you know, analytical study, it can be any trial, it can be cross-sectional study, but what is best suited for this question is a analytical case control study. But you should not write directly the steps. As it is a given, how will you plan the study? So you should find out who are the study population, maybe the adults, what is the setting of the study in a community or in an outdoor, what are the common ages, which community will select, and then go to the steps, who are the cases, who are the controls, then estimate the sample size, technique, calculation, then the exposure and outcome and the exposure rates. So you are writing the steps of the study, but critically you are analyzing how to plan the design of the study. And then comes what are the confounders, what are the bias for specifically this kind of study is a selection bias, recall bias, what are the limitations that whenever you go to find out the who are affected with this lipidemia and you go back to find out who are consuming alcohol, maybe at the daytime you may not find the men are at work, you will find the females. So these are the some bias, some limitations that may occur with the study, and you should go in detail with this type of questions. And there is an additional question given, what is a nested case control study? What is that? It is a study. It is an epidemiological design where cases and controls are selected from a larger pre-existing cohort. So this is all about, I am just briefing the points of the question. So this is about the first question. The next question was, briefly describe the levels of prevention and different modes of intervention to prevent the burden of COPD in your block. Now the first part, levels of prevention and different modes of intervention, is a very common question. Almost everyone faces it in either of any semester, in the theory or in the viva table or in practical part. So all of you know it, there is nothing to describe it, and it should be prepared by all of you in perspective of any non-communicable disease or in a communicable disease. So you know what are the different levels of prevention, primary, secondary, tertiary and primordial, and the modes of intervention. Now there is a second part of the question where it was asked, mention the known gaps in the natural history of disease. It is very easy, but it is a tricky question. It is written in the book, but we often miss it. So what are the different gaps? The gaps were absence of a known agent, multifactorial causation, we know it is a very common cause of any non-communicable diseases, long latent period and for indefinite onset. So these are the known gaps in natural history of the NCDs. Next we come for the group B questions, where short essay type questions are given of 10 marks each. The first question was about the waterborne diseases. Describe the steps of disinfection of well. What is BOD or biochemical oxygen demand, what is rainwater harvesting. Again, from the environment chapter, this is a very common area. Water is the most important. Next comes the air. So, if we go to the waterborne diseases, we may often think that what is actually asked, whether it is a waterborne disease or water wash disease or water based or water related or indirectly vector borne disease. But as it is asked about the waterborne diseases, we generally mean the agents like bacteria, virus, protozoa, what they causes like cholera, hepatitis A, salmonellosis, rotaviral diarrhea, poliomyelitis. So, we want this in detail. But if anyone answers the other words also like water based, water what, it is okay, but you should not write more. You should be very specific while answering, because this is needed as the time is short, and if we write unnecessarily where it is not, where the question is not asked to write, so you will have the time crunch at the end. So, it is better you should write or stick to the answers which is only asked. The next part was the disinfection of wells. This is a very practical questions where you face during the family posting, but still it is important, like you should write the steps like what are the, how to find the volume of the water, the depth of the well, the diameter, then calculate with the formula and find out. Biochemical oxygen demand, it is very important short note and it may be asked in many MCQs also. It is a test for sewage. It measures the amount of dissolved oxygen required by the aerobic microorganisms to break down the organic matter in a water sample. It needs certain times, days and also certain values to represent the BOD. There is again a very common questions we know, that is the how will you investigate an epidemic. It can be either given how to investigate an outbreak of food poisoning or sometimes an outbreak of fever or any vector borne disease, but here you should stick to the steps. There is very specific steps written in the textbook and you should follow that. Like here, what are the steps? You should define the epidemic, you should confirm its existence, confirm the diagnosis and then find out the number of cases, then you go for the time, place, person, determine who is at risk and develop and compare with the hypothesis which you have already developed, and then finally you have to write a report. So, these are the steps and you should elaborate these steps in terms of food poisoning. And finally, you should not miss, you should control, just writing the report will not finish your answers. You should control the measures or how recommend the control and implement the control measures. These are the final steps. There is again two parts are remaining for the questions. One is the short answer type or short note of 5 marks that are given very easy type, I am not discussing here, and the last part is the not the last part, before the MCQ we have the justify the statements. We are giving certain statements and you have to justify the statement. It is a very short type, you should not lengthen the answer, only 1 or 2 points is enough to develop your answers. Like here there is 5 questions like inertization is an essential step for biomedical waste management. Emerging diseases poses a threat to global health, etc., etc. So, I am going to the first question, inertization. Why? So, the question is inertization is an essential step for biomedical waste management. Means why it is needed, why inertization is needed, this much is enough. So, what you should write? It means inertization means what? You should minimize the risk of toxic substances. So, there is a procedure, you have to mix something to minimize the risk of toxic substance. Then I go for another question like community diagnosis is different from individual diagnosis. So, we know that community diagnosis, we deal with the community where we arrive at a community diagnosis, and medical social diagnosis what we do in the FAP, in family adoption program, and which is different from individual diagnosis. So, why it is different? Community diagnosis deals with the whole population, where individual we are diagnosis only to the person, identifying the specific disease and then giving the treatment to the single patient. So, this is the one point, and there are certain other points also you can elaborate. So, this is about whole community medicine paper 1, where I have selected some questions and tried to guide you how to write the answers. So, let us go to the community medicine paper 2. Similarly, we have group A long essay type questions of 15 marks each. In the first question, it was recent reports of pregnancy related deaths are reported in Cooch Behar district in increased number. Define maternal mortality, enlist the common causes of maternal deaths, mention the systemic and community level factors that may contribute to the problem. Write down the steps to be taken by district health administration. So, the first part, two parts are very common and it is a must know area, like define maternal mortality. So, you should just stick to the definition, what is maternal death or maternal mortality, and then comes the common causes of maternal deaths. So, you should not write here what is maternal mortality ratio or what is maternal mortality rate, not that, it is just asked about the maternal deaths. The common causes. So, there are several causes, means several ways to represent the causes, like some of the individual causes, systemic, social, community level. So, all you can write, but two common are asked here, like systemic and community level factors. Like what are the common causes, like what is the age of the mother, what is the level of education, what is the nutrition, what about her marriage, or what is the education pattern, whether she is working. So, these all may play an important role for which may lead to the maternal mortality. There are some socio-cultural practices, healthcare facilities, whether she availed the antenatal care or other care during the pregnancy, what are the social services, what are the different cultural practice. So, these all interplay a common thing which may lead to the maternal mortality. The next question was about the occupational health. A specific problem was given, like many adults from a village went to work in stone crushing units of a neighboring district, but had to leave the job due to progressive shortness of breath and weakness. What is the probable diagnosis and how it can be confirmed? Mention the various medical, engineering and legislative measures that can be used to control the problem. So, it covers the entire prevention part of occupational health diseases, and it can be very well written in a stepwise manner. Like we have medical includes pre-placement examination, periodical examination, what are the different medical and health services, supervision, notification of the problem, maintenance, health education and counseling, engineering measures, legislation. Among the legislation measures, we know there are two acts, the Factories Act and the ESI Act. So, it literally covers the whole prevention part and the health measures in the occupational health. So, you should always go, you must not miss this part in the occupational health. Along with that, we have the common questions like what is ergonomics, what is pre-placement examination. These are the common questions that can be added with this type of big question. Let us go to the group B short essay type question of 10 marks each. Again, there are 3 questions, but I will not be detailing all. Some questions I will detail, like there is an interesting question, what are the roles do the health workers play in the management of biomedical wastes. So, this is a area you should not miss, like what is biomedical waste management. Along with that, write down the steps of planning a behavioral change campaign, among them to improve the biomedical waste management in your hospital. So, it has added 2 chapters, one is the biomedical waste management and the other is the planning a behavioral change campaign. planning an IC campaign or BCC campaign which includes the health education chapter. So, you should understand this and write the answer in that way. So, how you do the steps of planning a BCC campaign? Like planning any cycle, planning any program, you should go first to the situation analysis and identification of the problem, deciding the hypothesis, setting goals, objectives. Objectives, it should be SMART, assessment of the resources like man, money, material, develop the strategies, preparation of the micro plan, and as it includes the health education, what are the communication channels, how will you communicate, which population you are targeting, and finally implementation of the program. And whenever the program is running, the feedback is very important, and for that monitoring and evaluation is also a part. So, these are in a short the steps of planning, and along with that these are the steps of planning in BCC campaign. The next part was what are the roles the health workers play. So, you should know who are the health workers who are dealing with this biomedical waste management. So, in addition to that, you should interview different categories of health worker like doctors, junior doctors, nurses, other staff, the waste handlers, housekeepers, lab workers, and you should also know how they use the sharps, how they dispose it, what are the different availability of the bins or the plastics, or what is available or the buckets. Then at the regular interval there should be training in order to the updation of the guidelines, and finally there should be display of certain recent guidelines of the BMW. So, in this way you should enrich your answers, not just writing the steps, but also include this kind of inputs to enrich your answers. The next group B question was, there was what the common physical and psychosocial problems among the adolescent population, outline the services available. So, you should go what are the problems that I am not discussing, but how the adolescent health service are there implemented in our state, in our country, that you should know. We have adolescent friendly health clinics, RKSK, RBSK, Anvesha clinics, nutritional program, sexual and reproductive health program, the mental health, the substance misuse or abuses, communicable disease, non-communicable disease. These are all aspects which are dealt in the adolescent health services. Two common services are the WIPS, weekly iron folic acid supplementation, and menstrual hygiene scheme, MHS. So, these are the certain steps or certain services you should write while giving the note of the adolescent healthcare services. Short notes are there, and in the group D we have the explain why or justify. Like there are 5 questions in the last semester. Breast milk is the ideal and the only food for infants below 6 months. Community involvement is essential to improve mental health conditions. IUCD is an effective contraceptive but not meant for all. Mother and child protection card is an example for appropriate technology. So, I will go to this question. Why this is, what is the statement or what is the justification is asked in the answer. So, why it is considered appropriate technology? Why? Because it is an equipment, it is a card which is scientifically very sound, adapted to the local needs, adapted to the needs of the mother, child, and also who are using this, the healthcare workers, ASHAs, and also shown to the mother. It comprises of a mother part, the child part, and several pictures where the antenatal care, the nutrition, or the growth chart, and many things are there. So, it is considered an appropriate technology. Community involvement is essential to improve the mental health condition. So, how will you write? What is actually expected from this question? So, it is needed that we should, as any person is residing in a community, so we should approach the community like integrating the mental programs in the school curriculum, implementing certain community stress management workshop, certain campaigns. These are the primary level of prevention in how you can give the care to the individual through the community. Early detection can be done from the community members only, like the local leaders, political leaders, or like the teachers, or in a school or in the working place, they can only identify the warning signs of distress or any depression or any anxiety, and then they can communicate to the doctors for the professional care. And also we should have certain rehabilitative centers, daycare centers, community level centers. So in this way we can approach to the Justify. So in this way, in this presentation I have covered certain questions with how to write the questions, how to answer them. I hope it is useful for you all. Thank you all, and best of luck for your coming professional exam.